Hello friends, today we are going to discuss regarding aortic stenosis. Aortic stenosis is the narrowing of the aortic valve orifice which results in obstruction of blood flow from left ventricle to aorta during systole. Now we will go through the etiology of aortic stenosis. Number 1, congenital. Bicuspid aortic valve is the most common cause in less than 50 years of age. Number 2, degenerative. Senile calcification in elderly more than 65 years of age. Then third, rheumatic. It is most common in developing countries. It is due to fusion of commissures and fibrosis. Now we will go through the pathophysiology of aortic stenosis. As we have already discussed, in aortic stenosis there is narrowing of aortic valve orifice which leads to obstruction of blood flow from left ventricle to aorta during systole, due to which there is increase in LV afterload. Increase in LV afterload leads to increase in LV pressure overload. Now it further results in compensation of left ventricle, which leads to hypertrophy of left ventricle, that is concentric left ventricular hypertrophy. This concentric left ventricular hypertrophy maintains cardiac output initially, but over a period of time it will lead to reduction in compliance, which will lead to diastolic heart failure and eventually left ventricular systolic failure. So hypertrophy maintains cardiac output and functions initially, but it reduces coronary reserve, which results symptoms in the form of angina, syncope and heart failure, which is a classical triad in a patient with aortic stenosis. Now we will go through clinical features in a patient with aortic stenosis. Number 1, angina. Angina is due to increase in oxygen demand due to left ventricular hypertrophy. Second, syncope. As there is fixed cardiac output in aortic stenosis, it cannot increase during exertion, which may result in syncope. Then third, heart failure. So patient may develop dyspnea due to heart failure and pulmonary congestion. If a patient develops these symptoms, it usually reflects poor prognosis in a patient with aortic stenosis. Now we will go through signs in a patient with aortic stenosis. So there is low rising, low volume pulse, which is also called as pulsus parvus et tardus. Apex beat is sustained and heaving in nature, and there is ejection systolic murmur in right second intercostal space, which is radiated towards carotid. There is soft or absent A2, and S4 may be present due to stiff LV. Thank you.